Hello and welcome to the Pause It podcast. I am Dr. Sam and with me is Dr. Robert. How are you?
Good. How you doing, Sam?
I'm doing great. It's
Yeah.
not my day off today. We're talking on a different day. So I did work today. But you know what? Those days are sometimes the days that we get some inspiration for our podcast. So it's part of what happened today. But before we get into that, how was your day?
Busy, just a lot of paperwork, and I'm like sweltering in my basement. There's no AC. Like most hot places don't have AC in San Diego because you don't need it most of the time. But I live like in the bottom chunk of a house, so it's like a dungeon, and it gets very hot sometimes. So,
Really, that's
um,
funny because usually when I guess if you have AC, the cool air usually sinks. And so usually the basements are colder.
I think it's
And
colder than upstairs, but I still have good airflow back here, so it's very nice and sweltering. So,
yeah, you need to get one of those like wall units that keep
yes,
you nice and cool without having
yes.
to put in an HVAC system.
Yep, exactly. So I'm gonna work on that in the future. But in the
Yeah.
meantime, I'm just really excited to be here.
Well, I am too. And so, as I was saying before, a lot of times cases that come up are what make us go, we've not talked about this. And it's been a little while since we've really chatted about a disease process or any disease processes. And so we thought we would kind of delve into the world of thyroid today.
This sounds exciting because I know very little about thyroid from ER stuff, and I'll be completely honest. But I'm excited to have a chat about it because we'll explain kind of the differences of the two of them, but I've seen like one version of it. But most time it's something like a lot of general practitioners are very good about diagnosing, and they see the signs of it all the time. So like, oh,
Yeah.
your animal has thyroid disease. So I can't wait to learn something in this podcast as well. So
Well, I hope that I have something to teach. But I think the thing that's really interesting is when we were talking about like planning for this podcast, like I was just expecting that it's something you see. It's weird. And then thinking about it, I'm like, you know what? I guess it does make sense that this type of disease process. So we generally, just to kind of put it out there, like we usually see a different disease process in a dog versus a cat. And so it's really important to know that with cats, it's usually an overactive thyroid, so hyperthyroidism, whereas with dogs, it's usually an underactive thyroid, hypothyroidism. And I think what's nice about this disease is it's pretty accessible to people because most people know somebody that has thyroid disease or they have thyroid disease. So it's like not totally foreign.
I would agree. I think people can draw some similarities to like their friends they have it. Like, oh yeah, my friend has
Right.
thyroid disease. It's not like a rare term like, hey, you have Cushing's. Most people don't know
And
what
they're like, what's
Cushing's.
that? Yeah,
Exactly.
exactly.
So, or kidney disease is a little more obvious, but yeah, thyroid at least everybody's got one. At least most people have one.
I
So
think everybody has thyroid.
yeah,
Else you'd be
thyroid
in a lot of
hormone's very
trouble.
important. For
but
sure.
but I do think that a lot of people understand, you know, some types of things about like either weight loss or you know what I mean? Like think people kind of understand like, oh, I mean, maybe people like jokes like, oh, I have like a bad thyroid, and so that's why
Mhm.
I'm, overweight or whatever, whether that's true or not. And interestingly enough, I've actually known a person that had low thyroid but was like exceedingly very thin and could eat whatever she wanted, which I always thought was so strange. And I'm like, are you sure you have hypothyroidism? I'm like, that doesn't
Yeah.
make any sense to me. But yeah, that was definitely the case for her, which I was like, well, lucky you, I guess.
Yeah. I mean, I wonder, can people get hyperthyroid? I'm sure they
Oh,
can.
absolutely. Oh, people
Really?
do. Yeah.
Yeah. See,
Yeah.
I'm gonna learn so much today. This will be a great podcast for all of us and
Yeah. Oh
listeners.
yeah, yeah, yeah.
Just
It's
to join
same
the
thing. So
audience.
people can be just like cats.
Well, it's funny. I mean, I think you've seen it, but like how many owners come in and will diagnose their cat with diabetes, and they're like, "Oh, I have diabetes too." I'm like, "Great, give each other insulin." Don't actually do
This
that,
is
but
going to be a good day because now I don't have to explain every in and out of.
exactly.
And what's funny is, at least with cats, not to go off the beaten path onto diabetes, which we'll talk about another day, but that's another disease process where the type of diabetes, and there's more than, I mean, there's like, we're talking diabetes mellitus, so this is DM. Like what happens in cats is not the same thing that happens in dogs. And
Mhm.
it's really pretty interesting because what happens with cats is much more akin to what happens to most type 2 diabetics in like the human world. And then with dogs, it's more like type 1 diabetics with like,
Yeah,
you know, so it is really interesting when you can kind of say to people, okay, well, this is a dysfunction of the thyroid, getting
yeah.
back to that, because people do have some idea of like what the thyroid does. It's really important for regulation in your body. And a lot of times things like weight are going to be a pretty big part of it.
Yeah, exactly. So it's so yeah, do you want to start with dogs or cats?
Yeah, so the case I had today was a cat.
Start
So
there.
I guess I'll talk about cats.
Yeah.
So this particular, so the story, right? So what does it look like? What should you look for in your pet? The story is my cat is eating all the time, is always hungry, and is like wasting away. My cat is so thin, and it's old.
And it's old.
And so like when I hear that history, I'm literally thinking about three things usually. I'm thinking, okay, first question, are they drinking a lot and peeing a lot? If the answer is no, then I'm thinking thyroid.
Mhm.
If they're like yes, that's other things that I'm thinking about, like diabetes or
Diabetes, kidney
disease.
disease.
But if they're like, the other thing is though cancer, because it does usually happen in our older cats. Now, it can happen in younger cats or middle-aged. I don't really think young. Usually if you're
I've
gonna
never
have
seen a young cat. I think it's always like middle aged, older.
middle to older.
Yeah.
And then I usually get like, I'm kind of hopeful in those situations that I'm gonna find a high thyroid because it's a treatable disease.
Yeah.
And that's one of those things where the majority of cats that have an overactive thyroid, so hyperthyroidism, have a little tumor on their thyroid gland. Kind of similar to when we were talking about the hyperparathyroidism,
Yeah.
which nothing to do with thyroid, but it's just near it. But same thing. There's this thing that's causing too much activity of the thyroid, and usually it's a benign growth, but it's still causing this problem.
Yeah.
There is a subset that do end up having, unfortunately, cancer. So they have
Yeah.
an adenocarcinoma on there. I'm pretty sure it's a carcinoma.
Mhm. Yeah, I think it's a thyroid adenocarcinoma. That's one. There's only
Yeah,
one I know off the top of my head.
adenocarcinoma. Yeah, that's the bad one.
Yeah.
And those ones are just you don't, when we diagnose it, we don't know which one it is. Playing the odds, they usually have the benign one and they're just making extra, thyroid. So
Mm.
our job then for the cats is to calm that down. And I think the conversation that I generally have with people when I diagnose hyperthyroidism is discussing like, what are the treatment options and like, what do we expect going forward? Because like I said, it's a really treatable disease, but there are other implications that it can have. And so like the very first thing we need to do is try to start them on medication.
Yeah. Well,
And
do
so,
you do you jump to that one like? Well, actually, I'll let you keep talking out because I'll ask you. I'm curious now from my own standpoint because I know one that I've seen a lot of, but in terms of treatment.
yeah.
But so you start them off. You usually have the conversation about medications first.
So what I usually tell people is there's basically 4 ways to treat thyroid. So
Yeah.
one is medication.
Yep.
Methimazole is the one that everybody uses.
Mhm.
Um, and then the second one is surgery.
Mhm.
The third one is iodine treatment, which is like radioactive iodine, which is probably the one you see, would be my guess.
That's the one I see the most of. And but what's the
Yeah.
fourth one? I was like, what's the fourth one?
YD, the food.
Oh, that's okay. That's fair. Let's see.
Um,
Lesson one.
yeah.
YD.
Well, and but the reason that the very first thing I do is say, okay, let's try the medicine first, isn't because my long-term goal is to keep them on medicine. There's been studies that show like well, we'll get into what the best treatment is, I suppose, but you have to make sure that there isn't also some other disease, because this happens in older cats. So often it's masking kidney disease, and you
Yeah.
don't know that until you have started treating them. And then usually about 3 to 4 weeks later, you recheck. Once that thyroid's down into a normal range, you can look at everything else and say, okay,
Yeah.
their BUN and their creatinine, like the signs that they have any like kidney dysfunction is either normal or it's not. So now we're going to be able to see what other options we have. Once upon a time, the definitive treatment was surgery. I don't think anybody does surgery. Like, does anyone do thyroidectomies anymore?
No, I've only seen I-131 and the medications, honestly,
Yeah.
just because they're. But I think the only thing I do see on ER is what you're talking about. It's they started treatment or they just went right to I-131, and then all of a sudden their thyroid disease goes away, but then the kidney disease that was masking it the whole time comes in like full force,
Right.
and you're like, oh crap, like that's like it just it catches the owners by surprise because they were completely normal beforehand, and it's a bit of a shock sometimes for owners.
Right. Yeah. And so that is like, it's a really important thing that you have to make sure. You can't just say, okay, well, we're just, going to go. I mean, I maybe there are doctors that do it. I don't know, but I would imagine you have, like, it's not like we do the iodine therapy where I work. Right. So like,
Oh.
that's a specialty sort of a thing. And just so that we're clear, basically it's radioactive iodine
Mhm.
that goes and basically destroys, ablates and it's not ablating, but I guess it just destroys the tumor.
Yeah.
And so then they're cured of their thyroid disease. But like you just said, I mean, it unmasks. And if it unmasks it to this huge extent, now you have a cat that has really bad kidney disease. Whereas if you have them on the medication and they're really, really well controlled, and then you start to see their kidney values kicking up, you then you have at least the ability to kind of play with things and find that level where you're controlling their disease. But like you said, you're not just like overwhelming them with, okay, now you have kidney disease.
Yeah, I think it's all the more important to for those pet owners like, oh, my cat's been healthy for years, and they don't see a veterinarian, and then like I've had owners like, hey, my cat hasn't seen a vet in 10 years, but those are the ones like will have the hyperthyroidism, and then but it's been going on for 4 or 5 years, so like it's taking effects on the kidneys and the heart at that point in time.
Right.
So like it's even when you think your pet's healthy, I mean they look great. It's still important to get blood work done every once in a while, because if it's something like that, you could stop it when it just started at the age of 5 or 6, as opposed to finding it when they're 10 or 12, and then you do start treating them for it, and then you see their kidney values are nuts because they've had hyperthyroidism for such a long time. Just no one knew it.
Right, right. And I think a lot of times people are a little overwhelmed by like the sticker shock of it, right? It's like, oh my gosh, I have to
Yeah.
pay to go and get this procedure done. But interestingly enough, so I have been working with this cat who has been a little tricky to regulate. Like when she was like a textbook, you have thyroid disease sort of cat. And she also, for some reason, and I suppose I have to actually look this up one day and like see if there's really truly a correlation or if it's just two old cat things. But like, so many of my thyroid kitties have
Mhm.
horrific mouths, just
Oh,
terrible
interesting.
teeth, and they
Mhm.
need to get a dental. But I don't want to put them under anesthesia until their thyroid is under control. so so this particular cat had just the most horrific mouth,
Yeah.
and she really needed her teeth done. And but we really couldn't, like, her thyroid was just out of control, and then she just responded just kind of too well to the methimazole. And then we were like, I had to back her off. And so finally we got her to this place where it's like, okay, well, your thyroid's better, it's probably not as well controlled as it should be just based on the numbers, but now we're starting to like at least be able to see that like clinically she's doing well, and everything else looks really good on her except for those things that are affected by the thyroid, which by the way is a lot of things, you know what I
Yeah.
mean? And so and thankfully with her, like, she hasn't gotten a heart murmur because of it, and which can happen. I mean, like, they
Yeah.
can have high blood pressure. I mean, they can have they can get thyrotoxic heart murmurs, which basically, like, the high thyroid affects their heart. I mean, there's a lot of things that can happen downstream from the thyroid disease that ends up causing problems. And so this cat right now is doing really, really well. And so I actually spoke to an internist today at Purdue who was like, she's at prime time for the iodine therapy.
Oh.
This is when she should do it. She's not a terribly old cat. I mean, she's like 11, and but she's got many years ahead of her. And her best case scenario to live the longest and have the best life, even just talking to this really awesome internist at Purdue. She's so smart. But she's like, there's studies that show like these guys are the ones that do the best. You know what I mean? Like,
Yeah.
having them on methimazole forever, it's good, but it's not without its downside. You know what I mean?
Yeah.
And so she was like, if they'll do it. And I was surprised. I mean, it's not to say that it's not an upfront cost, but it's not as expensive as I thought that it would be.
How much,
Maybe
if you
in
don't mind?
your hospital it might be. I don't know because you're
Actually,
out of
I think that's
hospital.
like the one thing we don't do.
Oh, really?
We do not do I-131. We used to a long time ago, but they yeah, they don't do it anymore.
Wow, that's surprising. And
Yeah,
do
the
you
whole
know,
thing.
like it used to be like when we were back in vet school, it used to be all the cats that came in for the I-131, they were there for like 2 weeks. Do you remember that?
Yeah. Yeah, I remember that's because I actually remember that my internship did it too. And I remember they'd be in these wards by themselves for a while because they're technically radioactive for a bit.
Yeah.
And
Well, they've cut that time tremendously.
oh
So
really?
now it's like 4 or 5 days.
Wow. Wow,
Yeah.
that's way
And
better.
actually I was looking up like there's a like a private hospital that just does it. Like all they do is the iodine and it's in Illinois, probably
Hmm.
not that far from where you worked, near Chicago. And
Okay.
they said some cats can go home in 48 hours, which I was like, I need to look into that a little bit more. Because when I was talking to the internist at Purdue, she was like, no, like 4 or 5 days usually. And I thought that, well, that seems a little safer to me, because we don't
Yeah,
have
that sounds
a
better.
radioactive cat. I think it was based on, I think some of it's based on the state law. So that's what it looked like. It
Okay.
was like there's a certain acceptable level of like when they can go home. And the iodine is, I mean, it's a radioactive material, so it is excreted from the urine and the feces
Yeah.
of the cat. So you have to be really careful handling their litter box. And so I think obviously they don't want anyone to be exposed to anything dangerous. But for these cats that, you know, can get this done and everything else is okay, you've just cured them.
Oh
And
yeah.
so, and that's what they do for people, by the way. I actually,
Oh.
my boss's husband had it and went and
Oh
got
nice.
therapy. And I was like, you're a cat.
You're fixed.
It's amazing. But yeah, and he literally had like all the symptoms. It's funny, like being, because he was married to a veterinarian, and she's like, looking back now, I'm like, you were a cat the whole time, like eating all the time, losing all this weight.
Maybe
Like,
that's what I have.
yeah,
No, that's very
yeah,
funny.
right. I must be a dog because I have the opposite.
No, get out of here with that nonsense. So, oh, that's funny. No, I think it's like cool. Like it's nice to be. I think if you've ever pilled a cat, you can already see the benefits of not having to do that because some cats are horrible to pill. Like they're just, and dogs are easy. They're not very bright the most time. The small ones are tougher. I think the big ones are easy. I love big dogs for that reason. It's just like open up and throw in the heat, and they're like,
Yeah, or just have a lab and they'll be like, it's a treat.
yeah, I love this.
I know when I made a little video about like how to pill dogs, and for for
I
my
saw the
mom,
video.
I was like, I mean, you could just have a dog like mine because he doesn't care. He's like indiscriminate. He'll eat anything.
Yeah, so I put a little peanut
Obviously,
butter
he
on it
eats
for
us,
Loki. He's good. So
but
I'm like, yeah,
yeah,
I put a little peanut butter on there for Loki. He'll eat it.
yeah.
It's just nice. I love dogs. Cats though, they're way too smart for that stuff. They're like,
Oh
nah,
yeah,
I'm
yeah.
not
They can
doing
like
this.
they can like see you thinking about giving them a pill, and they're like, I don't think so.
They're
But
smarter than we are.
but the thing, so it is interesting though, because just in my clinic alone, I have 3 forms of methimazole at all times.
Oh, really?
Yeah, we have compounded chicken flavored chews.
Delicious.
We have, for those cats that'll just, some cats, I mean, with thyroid disease, they'll eat a lot, right? So you can get away with a lot with that. Then we have like the like small generic pill that
Okay,
is just like it's the human. I mean, it's a, right. I'm pretty sure it's a human medicine, right?
I'm
I
sure.
think it is.
We'll
I
fact
don't
check
know
it
about
in the
people,
show.
but I'm
Oh,
pretty sure it is. And then but this is just like the generic. And then there's one that's called Falimazole, which is like a
oh,
coated tablet that's like, so some cats will just, I guess, take it better. I don't know. I never ever fill that one because I'm like, I don't, I don't want to mess with that one. But we can also get it compounded. So some people get it compounded into an oral liquid, and some people get it compounded into an transdermal for the ear.
oh, makes sense.
There can be some question with absorption with the
Mhm.
transdermal for some cats. So usually you want to start them out on the pill, make sure that they're like at a good dose, and then be sure that they're not going to go and do iodine or whatever. But for a lot of people, they just don't want to necessarily do that, or they don't think they have a cat that would do well, right? Like they're like, I don't think my cat would do
Gotcha.
well for, however many days in a clinic without me. But
Yeah,
I was
that would,
surprised. I don't know if I said it, but yeah, it was like $1,700 to $2,000 to do it.
it's not that bad, honestly. I feel like you would.
It's really, I mean, it's like akin to like what you would pay for a surgery, right? I mean, like, I think a surgery would probably be more expensive, would be my guess.
Oh, dude, now I'm curious. Like I almost want to look up methimazole and just see how much it costs because like how much you pay per month. I mean, probably I don't know. I feel like it'd be worth
Because
it.
it's not just that. Then if they're on methimazole, you need to monitor them. So it's like when I was like talking to the owner about it today, I was like, I know that it sounds like a lot, and it's not to say that that's not a lot of money. Of course it is, but the thing is when you really parse it out to having to pill a cat for the rest of its life, having to buy medicine for the rest of the cat's life, then anytime something goes wrong, you're always like, okay, let's check their T4 level. Let's make sure that, but then you're usually checking the whole blood work. So then you're talking about a blood work panel. Then anytime you change the dose, well, guess what? We're checking it again in 3 weeks to make sure that, you know what I mean? So like, it's one of those things where you really end up, I mean, this cat alone, I think we've checked her blood work 6 times. I mean, right there, that would have paid for the iodine.
I mean, yeah, and also they're probably eating more, so cost of food. God, that's been ridiculous. So there you go, little.
There you go. Everybody wins. And then, well, that brings me to the last one. So, there's a food that Hills came out with called YD that is iodine restricted. And if they eat that food and only that food, it can control their thyroid. It is my 4th choice.
Is your 4th? So I'm curious why it's your fourth choice.
Because I don't think it works as well, and it doesn't work as long.
Interesting. Okay. So when you say it doesn't work as long, like at some point it just becomes ineffective?
Yes, at some point the cats just don't seem to do as well.
Okay.
And it's not it's a genius thing when you are at the point where, because this year is the first year of me being a veterinarian where I've had, like, because I've diagnosed, I mean, so many hyperthyroid cats. I can't even tell you. I see it all the time. I know it's so weird to me that you don't see it.
It's like literally zero.
Right. I mean, and so it's something I see all the time, right? So, okay. Most of the time cats do great on methimazole. I don't have a ton of people who have taken me up on iodine. I have like a handful that have done it. And I think I'm about to get one more. I'm really hoping, because I really think it will be perfect for this cat.
Yeah.
The reason why some people don't choose to do it is, like I said, they don't think their cat would be a good fit, or their cat's really old when they got diagnosed. And it's like, at this point, their life expectancy, like, it doesn't make a lot of sense, or they already have kidney disease. And so then they're really not a good candidate anymore.
Yeah.
But what I had happen was, I've had now, I think, 2 different cats that they got on the methimazole and they just got really bad. Like, either they wouldn't eat or they had GI signs, like really, like, would throw up every single time. And we tried coming off of it and then doing it once a day, and then okay, and then let's see if we can go up to twice a day. And this one cat, I mean, she just couldn't do it. And the owner definitely did not have the money to do the iodine therapy. And she was a very nervous owner who I just don't think would have been able to leave her cat for, at that point, I thought it was 2 weeks. Now it sounds like it's shorter, but at the time I was like, well, it's 2 weeks. And she was like, no way. And so we put her cat on YD, and, her cat lived for about another year on that, I feel like if she had been able to tolerate methimazole, we may have lasted longer. But she did start to have some kidney changes. And the thing about YD is that, like, you don't have to, like, we treat so much kidney disease with food. The YD accounts for that, I guess, in some way. But they have to eat it, and only that. They can't get any other food. So then you're also getting into this world of, like, if you have multiple cats, if you it's just not, I'm glad it's out there, because in some cases it's your only choice.
Yeah.
It's not my favorite.
Well, but I think it's good though you went over some of the choices though, because one, I wasn't aware of that as an option. I should be, but just not.
You don't diagnose it, so.
Yeah, but I think it's cool to know like there are options, and sometimes you use multimodal therapies. Maybe you're using a combination of one and like two of them until you get to I-131 or something like that. So I think it's nice to know you have options, and it's a great conversation to have with your vet. Even as far as the food goes, actually, there's something I found out the other day. The cost of food for pet food has gone up 15% for the last each year for the last 3 years.
Really?
Yeah, the cost of pet food has gone up
So that means it's
15%.
made almost a 50% increase in the last 3 years.
Yeah, and I've actually like looking at my dog food. Yeah, my dog food's gone through the roof. So like it makes sense, but I was just like, damn.
Do you
So
think it's a manufacturing thing because of like COVID, or do you think it's
I think that
just
probably played a role in it.
everything's just so expensive right now?
I mean, I think probably a combination like because like, even our food, human food.
I was gonna say human food has too. Human
Yeah, it's
food.
gone.
All
Sorry,
food.
all food. I mean, it's got more
Our
expensive. Like,
chow has definitely gone up.
right. Honestly, I'm just close to going back to peanut butter and jelly sandwiches because honestly, they were cheaper and they were delicious. So
Right. Yeah. Hey, I eat peanut butter and jelly sandwiches all the time, but I have 3 kids, so
it's the best sandwich, honestly. And someone judged me the other day from eating one. I'm like, you know what? I will eat this sandwich all the time. It's
they're
great.
delicious. And the thing that's nice is like my one child likes crunchy, the other one's like creamy, so I get to have a little bit of both.
Honestly, that's the best part about being a parent. I think you could like eat some of their food and you don't feel as bad because like it's here. I'm gonna eat
I
it
mean, I
anyway.
feel bad because I eat the ends of all of their foods. So I definitely shouldn't do that. But the thing is, like, they leave the crusts with like the delicious peanut butter and jelly on the crust. Like the best part, I'm like, I'll just sit here and eat your crust. Like, what did you eat for lunch? 5 bites of mac and cheese, a chicken nugget, and peanut butter and jelly crusts.
Oh, those are the good old days. I miss those days. The best
And the
sandwiches.
butt end of everybody's milk.
Oh, I haven't had milk in years. That's so funny.
Oh well, you just gotta come visit.
I,
We'll give you mac and cheese, milk, and peanut butter and jelly sandwiches.
I'm sure Paul would love that. What do we need to get for Robert? Don't worry about it. He's gonna eat the same thing as the
You
kids.
have it
It's
all,
fine.
don't worry.
Yeah,
It just picture Henry only bigger.
yeah, exactly,
He'll eat all the same things.
exactly. We'll be great friends.
You will. He's lots of fun.
That's good.
He's almost 5, so he's super fun.
Oh yeah, we'll be fine. We'll be great time. So
But what was I gonna say? So then the other one that I had for the very first time this year when I was treating a cat, I've had two things that have happened that have never happened before in all the cats that I've treated. One had a reaction to methimazole where their liver values, so their ALT just
oh
went like through the roof. Like we came back to
oh
recheck and I was like, holy, oh no, go
oh
off methimazole. Don't
oh
take it.
no.
And meanwhile, the cat was fine, but like I was like, no, just stop it.
I thought you were gonna say the reason I was scratching my ear because I was like, is that the like that? Isn't it? Because doesn't methimazole cause ears or
Facial itching.
facial itching? That's what. See,
That's
that's
good.
all I
You don't
understand.
even treat it. You remember that.
It's like something
But
here.
I
Come
just
on.
had my first case of it.
Oh,
Literally
really?
had it. Absolutely. And I was like, I think your cat has itchy methimazole face.
The scientific term for it.
Yeah. Well, and the thing is, it's this cat that is old and has had diabetes and seroconverted twice.
Oh, really? That's annoying. You don't get to do it
Twice.
twice. You don't get to do it twice. You get one shot at
I
this.
didn't even think they could do it twice, but this cat did. So now the cat's not on insulin, but it wants to be diabetic any second. So I can't give it any steroids.
Oh,
But it
that
got a
actually is
super itchy
terrible.
face on
That's funny.
methimazole. And so I was like, uh-oh. I think we talked about this we were talking about on the last podcast because I was saying that like I went on the Moms with the DVM and I was like, how
Yeah,
long? How long is it going to take for the itching to stop?
that's a
And
good point. You did mention. Now I remember the
yeah,
topic, but yes, you did mention that.
but so it turns out for this cat, it took 5 days, but I also put the cat on Apoquel and it did great.
Apical's a great drug. Works very quickly as well.
Yeah, the problem is though this cat's not a good candidate for do you call it IL or just iodine?
We call it
Iodine
I-131.
therapy, so I never really 131. Yeah,
Yeah,
so that
I-131.
radioactive
Yeah.
iodine. Okay, I felt you were calling it something different. I was like, am I out of the cool loop? I just
Nah, I don't think
iodine
it's a cool look. I mean,
therapy.
like I said, I'm not cool. I'm just
He's
here.
cooler than me, so I don't know. I was like, the cool loop. Maybe I'm missing something, but yeah. So this cat, we're trying to see because she had been on methimazole, like a different form of it,
Mhm.
and seemed to do fine. And so I was
Okay.
like, well, let's cautiously try to go back to the other form. Technically, it's the drug and not the form that causes the issue, but every once
Yeah.
in a while, you'll hear stories where like they did the transdermal and it was fine, or you know what I mean,
Yeah.
and, or they went off that and it was fine. So I'm kind of hoping for this cat's sake because we don't really have a lot of other options except like I don't want to take this cat off of the low carb food it's eating to keep it
Uh,
being diabetic. I can't really give it
yeah.
bread. So yeah, so
That's,
I'm hoping if we stay on Apoquel and a like low enough dose to control the thyroid, we'll be okay.
yeah, it's always a tricky spot once you start getting like multiple diseases, like one's contraindicated for another, and it makes it very hard. And because especially because you can't explain to your cat or your dog, like, I need to eat this food. I know it doesn't taste as
And
good,
only this
and
food.
only this food. Like, you can't have my cheeseburger, or you can't have like you like just gotta, I don't know. It's our job would be, and I feel bad. I feel like I said, at the end of the day, I feel bad for owners.
Oh
Is
yeah, me too.
just it's not that's not a lot of times it's not a lack of effort, it's just compliance with their pet. Because some, like, I had heart disease dogs, they're just like, I'm not taking my pills. And you're like, well, if they don't take their pills, they, unfortunately, this sounds crude, but they're going to die because they need those pills to live. Like,
It's true.
just natural process. So, and their dog just tries to bite them every time they feed them. Like, this isn't gonna work.
Well, and
So
then it also like breaks the bond that like the whole point we have pets is like human animal bond. It's a real thing. And like if we have to if what we have to do to keep them alive disrupts that, then it's like, well, what have we done to quality of life? And it's like, you know what I mean? And so it's I totally get it. That's why it's I mean, compounding pharmacies to me are like such a godsend because imagine if we couldn't compound things into different forms.
oh yeah. Like, that's a really good point to bring up. There's more and more of them coming up, which is great. I'm at a couple of the last conference I went to, and it's great what they're doing. Like, the compounding, it just makes things taste better. We still have to get better taste for gabapentin because the one we have is like cherry, and I don't even like cherry as a kid, man. Like, that was the worst medication. Like, they're like, oh, it's cherry flavored NyQuil. We like that shit.
Nothing ever tastes like cherry, it's like medicine cherry. Well, I told you
Yeah.
ours is chicken marshmallow flavored.
See that one, I want, you said you tried it, right?
Oh yeah.
Yeah. Was it good?
I'm weird. I tried it.
I 100% I'm like,
Was
let's try
it
it.
good? No, it wasn't good, but it wasn't horrible. It was better than the taste of the powder by itself.
Good enough. I can take that. So
You know, I don't know. Most of the like the cats do fine, and the dogs. I mean, they all do. Do you want me to like send you some? Should I bring some?
yeah, next conference,
Like,
send
here
over
you
some.
go. Here's some gabapentin for you. Just try it with a few of your in hospital pets and be like, what do they think of this?
Just curious
But
now. It's like,
we got it compounded, you know. And so for like we have it at our clinic to be able to prescribe out. Now that's different by state. Not all states, you can't do that in every state.
yeah, that's fair. And I mean, yeah, I don't trust what dogs eat anyway because they eat, I know, like, their own ass half the time. So I really don't take their quality of food to
True.
heart.
True
So
story.
yeah, it's like when a lot of times, like, when they won't take a pill, I'm like, I see what you do. Like, I see what you eat. You eat your own shit
Like
sometimes.
why this? Why
Yeah,
this?
why is the pill a problem here?
Yeah,
Like,
yeah. You're like
so
you just went outside and chewed on a stick. That
yeah,
probably
exactly.
why
Right.
won't you eat
I
this?
was like, take the pill, take the thyroid pill. Damn it.
Yeah.
Which brings us to the next one. Dogs and thyroid
Dogs.
disease.
Yeah.
They're the opposite. The only
Hmm.
thing that I do know is
Yeah,
that they're low and
it's
not
true.
high like cats. Sam, take it away.
No, but I mean, I will say it's like that story. First off, I do think there are breeds where we see maybe a big difference between cats. And it's like, I don't think of, oh, this breed of cat gets
Mhm.
thyroid disease. There may be one, but for the most part, we see like domestic short
I
hair
think
long.
you're right. I don't think I've seen a breed predisposition
No,
for it
I've
necessarily.
seen them in all shapes and sizes. I do feel like orange cats like to get thyroid disease, but they like to get a lot of weird things. So, you know, I
Yeah.
mean, and I don't know. I really do love cats. So I don't know. They just, but they do all shapes and sizes get that. But, I feel like with dogs, there are certain like golden retrievers, like they are pretty well known to get thyroid disease. You see it in a lot of labs. You know what I
Yeah.
mean? And they get thyroid disease. And so usually the history there, the story that you get told by the owner is you told me last time that they needed to lose weight, and I have cut their food in half, or I literally fed them nothing but green beans for the last month and they're not losing weight. And then you look at the owner and you're like, are you a liar or are you, no, just kidding.
I mean, it's just like, why is this not working? This should be working.
No, it's not that. But some people, every once in a while, they'll be like, I don't feed him anything. I just give him a half a cup of food in the morning and half a cup at night. And I'm like, okay. Mm-hmm. And then as we're talking, they're like, well, when they get these little bones, and I'm like, I thought that they didn't need anything else. Well, I mean, I give them the bones in the morning and the night.
Yeah, I know it's fine.
Okay. And how about the yogurt? And the they start like being like, well, I'm like, so what human food do they get for the day? But when you've really nailed it down and they're really not overfeeding their dog, and their dog is not losing weight, cannot lose weight, and then you start delving into it a little bit more. How's their energy level? Do they seem to be a little more tired than they used to be? And like sometimes they're like, yeah, but I guess I just thought that they were slowing down. I thought that they're a middle-aged dog, and I thought the other thing is I'll say to them, well, do you ever notice that like they'll go and find a heat source? Like they go and find the like radiator and they lay on it. Most dogs are going to go find a cool floor and lay down, but thyroid dogs tend to go and find a heating vent, or they tend to do something because they're having trouble kind of regulating things in their body, and they go looking for heat. There are some other weird things. So like I had this one dog who was overweight, but he had been chronically overweight. And I was never even like, they were like, we feed him, they were really trying very hard to, and they never said that they were like, he was just like, but he was really had gotten more and more aggressive with other dogs, and they were wanting to get a puppy. And so they were like working with a trainer to see if they could have him accept another dog. And she was like, oh, well, you should get his thyroid checked. And I was like, what? Turns out dog was hypothyroid.
Really?
Yeah. And it actually is like a reasonable thought process. And I mean, again, like I never think I know everything. So when someone says something, I'm like, I'm not sure. Why not? I was like, your dog's fat, so let's check. But like, the other thing is if you have dogs with like dermatologic issues, especially if they're not getting better, like you're seeing these chronic issues and you're like, I don't so like usually if you send a dog to a dermatologist for a derm workup, one of the first things they're going to do is check their thyroid and make sure that they don't have some sort of dysfunction there, where they're not going to be able to get that under control until the thyroid is controlled. So that's another place where we'll find it.
So that's interesting. So I'm curious, when you're like, so when you see sick dogs, do you bother checking? And there's a reason for this question, but do you bother checking a thyroid level when you see sick dogs?
So that's not how, so like just checking a T4 on a dog is, especially like what I think you're driving at.
Yeah.
That sometimes our thyroid will be low because they're sick. And in those cases, you could really have a little red herring there. But I don't diagnose. So when I diagnose thyroid, it's going to be much more similar to, I think, the way that people kind of understand it when you go to the doctor and you get blood work done and they check your TSH. So I mean, like, I'm never going to diagnose a dog based on a T4, which is like their total thyroid. That might give me an indication that I need to dig deeper. But our blood panel doesn't even have that for dogs. I have it for cats, but not for dogs.
Do you feel like a dog will actually ever come in though for being sick with hypothyroidism disease? So I guess that's like, so any signs like sick enough, like you said, most of the signs you're referencing right now, and there's other ones too, obviously. There's not just those ones, but like, there's maybe a moment of aggression, which is kind of weird, or they're gaining weight, or there's some skin things. Nothing that would ever rush a owner into your clinic. But is there anything that you think like, because I always see, I've seen dogs are treated with hypothyroid, like are treated hypothyroid, or I've seen like some, what you reference, like the falsely low hypothyroid dogs when they're actually sick with something else.
Yeah.
So I've seen that type of, I guess, have I ever seen a dog come in for being sick as like, I'm just sick because I have hypothyroidism?
I think it's such a chronic condition that is like an insidious condition. So I feel like it's not one of those ones that has a real clinical breaking point. I mean, maybe that's wrong. I don't know. I've not seen it though.
I've never seen it either.
I
That's
know
why
they
it's
can
weird.
get that like face, like their face can change. You know what I mean?
Mhm.
Like they can get it has a name. Can't remember exactly what it is, um, but like even that, I think it's like a slow, insidious change that will make
Yeah.
them fat, and then you know what I mean? Like, I think even predisposes them to like cruciate disease. I think
Oh,
then it could just be maybe because they're fat, but
yeah.
um,
I want to say you're right though. I actually want to say you're right on that
yeah.
one.
And the other one too is I've heard. Now this is definitely not a evidence based sort of a thing, but um, laryngeal paralysis, there being a connection
Interesting.
to because I definitely had an like an older doctor that I was working with that like this dog had laryngeal paralysis and like other signs, and he like started him on levothyroxine, and I was like, I mean,
Interesting.
yeah,
Yeah, I'm curious.
yeah.
I
So
guess
I do
I
think,
got some things to look up after this. I'm
well,
curious.
no, but I think these are those weird ones. These are those
Yeah.
like, yeah, I wouldn't hang my hat on it, and I certainly wouldn't be starting
No.
on like
Yeah.
thyroid disease without checking. And so what we do is we actually send, so Michigan State has a panel
Okay.
that we send all of our, it's kind of the standard of care to check those things. And Michigan State, I think, is the one that has like
The place
they're
to
not
do it.
the only ones, but they have a whole panel that you check.
Oh, nice.
And so that checks like the T4, the free T4, and then so the free T4 is like I guess the usable thyroid in the body
Yeah.
versus just the total thyroid, which is a number that is a good indicator, more of a screening, not necessarily a diagnostic. And then the thyroid stimulating hormone, which in a dog that's got thyroid disease should be really high because it's like
Yeah.
trying to get the body to make it, and it's just not making it. And then
Yeah.
the free T4 should be low. And then so then you're like it's this whole feedback loop that that's how the endocrine system works. It's like something tells this thing to turn on, and then this thing's not listening to this, or it's listening too well. You know what I mean? Depending on the disease process.
Yeah.
And then there is also that like auto antibody. That's a whole other thing
Mhm.
that I really have only had like pretty classic thyroid cases. So I'm not
Yeah.
even going to be able to get into all that at the moment. But I will tell you that that's usually the biggest thing. So I've definitely had those cases where I'm like, ooh, like the TSH is like starting to get high, so we're not at the place where we need to be on levothyroxine, but if you give it enough time, like we're gonna have to do it. And that's the medicine. So it's basically synthetic thyroid that you then end up supplementing. So it's the opposite of what we do in a cat. In a cat, we're trying to like dampen it down, stop it. In dogs, we're trying to be like, here is thyroid. You need thyroid.
Well, cheer team. Yay.
Yeah.
Okay.
and and they do, like, I will tell you, like, I've had so many owners be like, they're like a puppy again. Like they have all this energy, they're doing so well, they're losing weight, like they look great, their skin's so much better, so I mean, it
That's
really
nice.
is amazing that's a very rewarding thing. Like if you
That's
ever
really nice actually, because you get to where like these changes are happening to your dog, and you may just thought it was like old age or just maybe they're
Mhm.
gaining weight, and then the whole time you realize like it wasn't my fault. I didn't do anything
Yeah,
wrong, just
right.
genetics, and it's something that's fixable, makes or at least manageable. It's pretty cool.
Yeah, and it's manageable for a very long time. Like
Yeah.
I don't think, like you asked before, like I don't really think I've ever seen thyroid like be the I've never seen a dog die from thyroid disease.
No, I say I've never seen a dog die. Like it's had, I think it's had like its consequences of not
Right.
being treated, but not anything that would be like dire. I think,
No.
just
Mm-mm.
maybe unhealthy habits, so to
Yeah.
speak.
But I
So that's
mean,
what I'm
I've
wondering.
seen some dogs do so well.
Oh yeah, well that's cool about it, and because cats are the same way in terms of like their hyperthyroidism.
Mhm.
I guess they'd say it's more just causation of those of the disease that can cause problems like we talked about the kidney disease and the heart disease.
Mhm.
Every once in a while they get like a thyroid storm, but like that happens so rarely.
So you'll have to tell me what that look. I've never seen that. So like
Honestly,
what
I
does
it
it
was
look
my
like?
colleague that saw it. I haven't even seen I because we only talked about I think in class
Mhm.
way back when. That's been so long since
I'm
like
like, I don't really even remember that.
I remember because I was like, oh, it's the only emergency thing I'll ever see, and because I was like, I'm not going to worry about this endocrine stuff. Hence why we're here today. So we all pick our interests, right? That's why I went to ER. But yeah, it's
Like I don't have to worry about the endocrine system.
right. Like I just want to come in very go figure. But I just remember they come in very shocky, and it's like I remember like the thyroid disease that comes with it. But I'll look up next time I have the information for you guys because
Yeah, I was gonna say I've never seen it, so I don't, you know what I mean? I
it's
really
super rare. It's
yeah.
so rare. Like I would think I've seen it. Like I've seen a lot of cases, and not one has ever had that. So yeah, I don't know.
Well, now you know what's gonna happen is we're both gonna see one or something.
Oh, 100%. We're both gonna come back next week like I saw one.
Like, damn it, we put it into the ether. Why did we do that?
Sometimes I do feel like that. Like we talk about something, and like I see it the next week. I'm like, gosh,
You're
gotta
like,
be careful what we
why?
talk about. Yeah,
Yeah.
gotta be careful what we
It's
talk
like
about here.
burn sage after like every like podcast. We're like, okay, we're not gonna, you know,
Possibly like, what are you doing down there? Don't worry, I'm trying to make my week
burning
easier.
sage.
Yeah. Oh
but
God.
yeah, I mean, I think the take home is like these are treatable diseases, but this is when you start to notice things, small things like all of a sudden my cat's eating everything and is getting skinny. You know, don't just think, oh, it might just be old age. Just get him checked, bring him to the vet. If you think your dog is like, you know, man, he's really laying around a lot, like seems like he's cold all the time, or like he's getting really fat and I'm not feeding him very much, like get it checked because you might be, you know, fighting a losing battle. So and yeah, these are the diseases we like to find. So
yeah.
please bring them to your veterinarian and they will be so happy to be like, great news,
We can fix
best
this.
chronic disease we can give you.
Honestly,
As if we choose to give it to them.
But yeah, I think it's nice, like you said, if they're around that middle age and you're starting to notice those changes, I think that's great advice. Go get them checked out because it's a little bit of blood work, but it goes a long way. So
but especially both of those diseases, like Robert, you said really well, like there are things that can happen if you ignore them for a really long time. I mean, thyroid disease your thyroid is such an important function in your body, and like it really is something that helps regulate a lot of things, and the consequence of ignoring it are dire, but it's so treatable. And really, I mean, like you said, dogs, very easy to stick a pill in their food every day.
Yep.
Problem.
They're very amenable to it.
Absolutely. Especially because like you really think about the dogs that get it. They're like the dogs that all like to eat.
That's the best
Beagles
part
too, right? Beagles, labs. Yeah. I mean, sometimes.
Yeah, it really is. Maybe that's the common factor. It's the dogs that like to eat.
The dogs that like to eat. Their thyroid's like, I'm done.
Oh, that's funny. But yeah, it's very true. Most of the big guys like to eat. So beagles, yeah.
But if you have any questions, you can always email us at podcast@mybalto.com. We're happy to talk about anything that you find interesting. And I don't know. I think that's about it, right, Robert?
Yeah, I guess we'll see you all next week.
Yeah, thanks so much for listening. This has been the Pause It Podcast. Have a great night.